What is rehab or rehabilitation? My name is Fred Bigueras, a board-certified sports and spine medicine physician in Virginia Beach, Virginia. After 10 years of practice, I still find musculoskeletal medicine both fascinating and challenging. This podcast is about the lingering thoughts and questions I've had after residency and fellowship. My hope is to spark discussion, challenge dogma, and share my experiences in musculoskeletal medicine. Welcome to the Talking Rehab podcast. I have to go back and talk about why I actually got into physical medicine and rehabilitation. Going back to high school, essentially, I was kind of focused on going into medicine, but I hadn't really thought about any other field. So I started shadowing in physical therapy clinics, and eventually I started working in these clinics during college. I was a pre-physical therapy student, taking all the prerequisite classes up until the very last year. At that point, I decided to switch to go into medicine and specifically osteopathic medicine. I was really drawn to the manual medicine component of osteopathic medicine, and I started working for an orthopedic surgeon or a hand surgeon right after college while I was still gathering together my prerequisites. And that also really intrigued me. So heading into medical school, I thought I was going to be an orthopedic surgeon. So for the first 2 years, that was really kind of what I focused on. But then once I got into my clinical rotations, I believe my first surgical rotation was OB-GYN, and as soon as I got into the OR, I really did not like it, like at all. And I did like clinic a lot, but obviously as a surgeon, I knew almost immediately, like, wow, this is not the place where I like to be. I realized that people that want to be surgeons, they kind of get lost inside of the OR. They lose track of time. And almost immediately, as soon as I got into the OR, I was watching the clock. It just didn't feel like my natural environment. However, I really did like being in the clinic and counseling people. So I knew I wanted to do something that was in the musculoskeletal realm. And when it comes to the medical field, that there's really, orthopedic surgery and then sports medicine fellowship. And at least at that point, that's all that I really knew. But I ran into a couple senior medical students who had recommended that I look into physical medicine and rehabilitation. And at that point, I had no idea what it was. So I actually went into family medicine, thinking of potentially going into sports medicine fellowship afterwards. And I got into my 4th year of rotations. I had done a lot of family medicine rotations, and I was pretty much set. I was like, wow, this is what I want to do. I want to go into a fellowship, which is a 1-year program after residency. So I was looking at a lot of these family medicine programs that kind of were focused on musculoskeletal medicine. And that, again, was a time where I was down to the wire, about to apply. I had already asked for letters of recommendation. And then I ran into another senior student who said, you know what, you should really look into physical medicine and rehabilitation. And at that particular point in time, it was really hard to get rotations in PM&R. My medical school was in Arizona, and we didn't have a residency program, so it was kind of hard to rotate. And as some of you may know, being a medical student, some parts of your schedule are modifiable and some aren't. Fortunately, I happened to be in a state and at the right time where I could rotate at a residency program, and I could actually see what physical medicine and rehabilitation was about. And almost immediately, I felt very comfortable, and I really, really liked what I was seeing. It was an inpatient rehab unit, and I was seeing people with traumatic brain injuries, spinal cord injuries, and I was fascinated. I mean, just right off the bat, I hadn't actually seen the sports medicine or the musculoskeletal clinic at that point, but automatically it felt very different, and I felt very comfortable. So I naturally was very conflicted at that, because at this point, it was pretty late into the applications, or the application was about to start, and I had letters of recommendation for family medicine. And now I had to research PM&R programs and essentially start from the beginning. So, long story short, I was able to do all of that, request new letters of recommendation, and then eventually applied into a program. I ended up going to the Rehabilitation Institute of Chicago, which was affiliated with, or which is affiliated with Northwestern University. It was an amazing program. And again, I did rotations in all of the inpatient specialties. I also went into the outpatient clinics. It was a great experience. And as a sports medicine physician, I'm sure a lot of you guys are probably thinking, why were you so fascinated with spinal cord and stroke injuries? And to be honest, what really got me interested was the movement aspect of things. And that's really what has driven me. Looking back, I guess this is what has always driven me. It's how people move and how people get injured has always been a driving feature of my clinical interest. Something else that also drives me is how disease and injuries affect how people move. And that's, I know I'm being a little bit particular, but I don't really think that at least medical school really talks about this. I mean, there are certainly other medical specialties and there are other fields of health science that do focus on this, but for a medical student or even a physician, you don't really think too deeply about this. Someone gets a stroke, someone gets a spinal cord injury, you just kind of assume that that's it and that's how they're going to move. But we don't really see them long term. And that was actually one of the big issues that I had with surgical specialties, because, again, a lot of the focus naturally was on the surgery and the short term surgical outcomes. So I was always very interested, not necessarily how people did at 3 months. It was really how they did in life overall. And that was something that I think is unfortunately still kind of missing in medicine and rehab. Again, from a physician standpoint, at least, it's missing. PTs, OTs, they I think really occupy that space in terms of how do people actually do it, which is one of the reasons I like to work with them very closely, because a lot of my questions are still really surround how do people do. And so again, that kind of leads to my last driving feature is, how do people move after injuries? Once, the fracture's healed or the stroke has organized and things really settled down, I was very, very curious on how people moved. And that is what really drove me to PM&R, is that we're one of the few specialties that actually studies this in detail. PM&R residency for me was amazing. I came out very comfortable with treating people with neurological injuries. But I still had a lot of questions regarding the musculoskeletal system. And in a way, I think I was just kind of a very, very odd resident. I just always had more questions. I was interested in everything. One point, I was entertaining a spinal cord injury fellowship. When I got onto the peds floor, I was thinking about pediatric rehabilitation fellowship. I mean, I think, all over the place with my career trajectory. My fourth year of residency, I was actually looking at jobs where I could do some outpatient musculoskeletal care and also have an inpatient unit, and those jobs just simply weren't there. So when I started, looking at what is my next career move, that's actually when I started thinking about doing a sports and spine medicine fellowship. I just still had so many questions about why does a injured shoulder move like this, and how does a cortisone injection change their overall function with time, and is this the best move? Of course, fellowship training, a lot of it is really for skill training, but I was kind of looking for someone to shape or mold how to think, because there was a lot to learn in residency, and I don't think you really have a lot of time to digest it. Particularly, you're not really practicing. You're really just shadowing people, and you're learning people's styles, and you just kind of assume that what they do is the correct way. I just felt like I didn't have all the questions answered. So that was a really big driving factor into why I ended up going into additional training with a fellowship, and it was amazing. And I wanted to circle back real quick to discuss a little bit more about my decision to switch from family medicine back to PM&R. And it pretty much comes down to the fact that, I was searching for a family medicine residency that would give me the most exposure to musculoskeletal conditions. And after a while, I was like, well, why don't I just go into PM&R? Because essentially every single rotation has to do with some sort of condition that has affected movement. And I still really like family medicine, but I wasn't as interested on hypertension and chronic lung disease and heart disease. Obviously, those things are super important and they do play a role in rehabilitation. But when it comes to actually sitting down and learning, and I always come back to musculoskeletal stuff. So why don't I do a residency specifically in musculoskeletal medicine? And that, at least from the choices of specialties, was really PM&R. I thought briefly about going into neurology and rheumatology, and neurology for me was, and even rheumatology to an extent, was really very focused on just on diagnosing, which is obviously super important. But again, I was still very interested in, well, how do they, after diagnosis, like, how do they move? Like, how does this disease progress in life? Does the treatment actually affect, how they move for the rest of their life? Like, that was really still kind of my focus. And, a lot of, these specialty clinics that take care of chronic conditions, I think they do answer that question, but I was really looking at it from strictly from a musculoskeletal standpoint. And again, that comes back to PM&R. That is really the only medical specialty that looks specifically at movement. And you could argue this from every specialty standpoint, but at least in my opinion, that's all I personally look at, is how do they move? That's it. I care about everything else, but it is in the lens or the context of, does this treatment, does this diagnosis affect how they move? That has always been my primary question. And the only way I could answer it was with a PM&R residency. So, overall, that's kind of story of how I got into PM&R specifically. Created this podcast to share my thought process. I'm sure that there's so much more information about the field compared to when I was applying. So thank goodness for the internet, right? But if you guys have any questions specifically about, again, my decisions and things like that, I'm happy to talk about this offline, or make sure to drop a comment. Thanks again for listening. Thank you for listening to the Talking Rehab podcast. I hope that this podcast stimulates you to question your own practice and how you approach rehabilitation. I truly appreciate your time and attention. If you enjoyed listening, make sure to like and subscribe to the podcast. I wish you a movement-filled day. Take care.